Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute. Today we will be discussing about surgical procedures we need in case of obstructive or azoospermia. So now we have various types of procedures for in azoospermia. So one is TISA, one is TSA, third one is micro TSA, and fourth one is FNA mapping. And if you are taking sperm from epididymis, then you have PISA and MISA. That means you just put a needle into the sperm tube and collect the sperms. So now many people they ask me, doctor, what is the difference between testicular biopsy, open testicular biopsy and TISA? So TISA means testicular sperm aspiration. So open testicular biopsy, which was done in the olden days, is just like any other surgery where we cut the testis, we take them to theatre, we cut the testis, we do a surgery, and we take a small piece of testicular tissue and we send it to the pathology lab. So, but nowadays we are not doing that because it is a outdated procedure. So, what happens is, see, testicular tissue is different, may be different in one area, and see, entire testicular tissue may not be same. So, what happens if you take tissue from one corner of the testis and it may not represent the entire testicular tissue. So, that is why the TISA procedure has come in. TISA procedure is a simple procedure where we give anesthesia to the testis. Generally, we apply a cream to the testis, most of the testis becomes numb, and then we take a small needle. Generally, how we take blood from the veins, same way we take testicular tissue from various regions. So, advantage with TISA is this is not a surgery, this is only a aspiration procedure. And like if you compare with testicular biopsy, in testicular biopsy you take tissue from only one area. Here in TISA you can take testicular sampling from multiple areas. So, generally we call them as testicular mapping biopsies. That means you can actually map the testis, or it is also called as FNA mapping biopsy. You can actually divide the testis into various quadrants, various segments, and you can name each and every segment like segment 1, 2, 3, 4, 5, 6 and 7, 8. Generally we can map testis into 12 quadrants, and from each quadrant you can put a needle, take the tissue, send it separate to the lab. So, here what happens, you know which area of the testis you are having sperm. So, but since FNA mapping is quite expensive, generally we do TISA procedure where we take sample from 3 areas of the testis, and this report generally comes after 3 to 5 days based on the pathology report. And pathology report, what will it tell us? So, it tells us, 1, whether there is production inside the testis or not. 2, if production is not there, why it is not there? Can we give some hormonal injections and can we increase the production so that we can get some sperms for IVF procedure? And if there are sperms inside the testis, whether the quality of the sperm is okay for IVF procedure, and if there are immature forms, at what level there is immaturity, whether we can treat them or not. All these issues we will know in this biopsy report. So, now what is micro TSA procedure? People ask me, doctor, what is micro TSA procedure? Micro TSA is like open surgical procedure. There are no sperms in the TISA. Then we do micro TSA procedure where we completely open the testis. Then you have to take a very high power microscope, surgical microscope, and you have to, under the microscope, you have to search for the healthy tissue inside the testis. This is a time taking procedure. It may take 1 to 2 hours because you have to search the testis for healthy tissue, layer by layer you have to search, and both the testis we have to do at the same time. By the time we complete this surgery, it may take 1.5 to 2 hours. And the yield of sperm retrieval is totally different from TISA and micro TSA, because micro TSA is more advanced procedure, but slightly it is like a surgery. But TISA is a needle aspiration, which is very simple. For people with obstructive azoospermia, most of the times we get tissue sperms with the TISA procedure. After TISA, immediately a person can walk back because there is no cut, there is no injury to the testis. It is only like how we take the blood from the veins, it is only a needle procedure. I will try to post all these videos regarding TISA, because so many patients who are preparing for surgery, that means if when a doctor says you have a procedure called TISA, generally they are looking at some old procedures which are done with very big needles, and by the time they come for the surgery they are worried. So now what we will do is we will post all the videos which are videos of TISA, TISA, PISA, MISA, micro TISA, FNA mapping, all these videos, and we will also post videos about what is done once we take the testicular tissue, what is done in the embryology lab. So how they tease the tissue, how a sperm looks under the microscope, how this sperm is prepared for IVF procedure. All those videos can get at least 15 to 20 videos. We'll try to do all those videos. Give us some time, probably by this month end we'll finish all those videos. Keep watching, viewers. Please subscribe to our channel. Thanks for watching.